Okay, so this is our Kinetisense 360 assessment. This is a motion assessment. I'm Dr. Scott Hoare from Alcoa Chiropractic Center in Alcoa, Tennessee, and we're going to go over the results of their movement screen. So we performed this movement screen. She is 8 or 9 visits into her chiropractic care. She presented with low back pain. She is 6 months pregnant. She's a ER emergency room tech, so she's moving around beds and patients and very physical job. And she's finding whenever she's lifting anything, she's in a lot of low back pain that wasn't really happening before she was pregnant. So she's come to us, and actually her pain levels have gone down nicely. Not a lot of discomfort in the lower back, so it was time to do a movement assessment to see, all right, where do we go from here with her care? So we checked it out. This progress exam we do, it's kind of a full body scan to see what other areas should we be aware of with her physical health. So you see her neck flexion is really nice. The American Medical Association says we should have about 50 degrees with cervical spine flexion, and we're at about 60. So we are very happy with that. Next is cervical spine extension. If you see it right there, we want 60 degrees. She is at 66 degrees, so we're very, very happy. Neck rotation to the left, she's scored a 98%. So let's look at the data with that. She should have had, we want 80 degrees in left rotation. She had 78.6. You could see it right there. So yeah, okay, that's fine. Not necessarily a terrible score. Right rotation, okay, 84%. So that's a little bit lower. Let's check this out. We want 80 degrees of rotation. It looks like we've got 67 degrees. So that is a bit of an issue right there. That is certainly a shortcoming. Now with this patient, we've been treating her lower back. We have not been treating her neck at all. So it seems appropriate that we would start looking at the neck, because you know how the neck moves, and especially when there's limitations to it, that can contribute to compensation and added strain and stress on the lower back portion. So that's something we're probably going to want to address going forward. Let's see here, flexion, spinal flexion. So this is kind of like thoracolumbar and pelvic. And we got 90 degrees, what is what we want to see. We're seeing 105, so we're very, very happy, and it looks like that's pain-free, so wonderful. Back extension. Okay, so we want 25 degrees of extension, and this is a little bit more like 23, 24 degrees. So that does look like a little bit of limitation. It's not a huge deal, but something for us to note certainly going forward. We want that to be a little bit easier for her. Left lateral flexion looks beautiful. We are at 29 degrees. We want to see 25, so we're very, very happy. Right lateral flexion, we're very happy there too. 26 degrees, we want 25. Yay. All right, and then finally the lunge. Now with the reverse lunge, what you'll notice, she scored an 80%. So why did she score an 80%? Well, it looks like on the right side, when her right leg went back, she rotated her shoulders. So that is actually a sign of a little bit of instability. When you are moving through your your legs with a lunge pattern, you want your upper body to be relatively stable. So she was getting excessive, inappropriate motion from the upper body during her lower body movement. So that's something we're going to want her to address. So she's going to be able to do that through stability and strengthening exercises, and especially given that she's pregnant, definitely is something that we want to see going forward, is her getting a little bit more stable. A physical therapy referral might be an appropriate option. She might just be able to pick up doing more exercises at home. We'll see, but that is her progress exam assessment using the Kinetisense here at Alcoa Chiropractic Center. I'm Dr. Scott Hoare. If you want to check out more about Kinetisense, be sure to contact me or check out the link for the Kinetisense. Take care.